What's going on, everyone? My name is Curtis. I am a pre-licensed therapist, and I appreciate you tuning into today's video. On the agenda for today, we are talking about supervision and preparing for it. So I'm speaking therapist to therapist. So with that said, supervision provides, as we know, a space to vent, talk about any challenges that are coming up in the therapy room as a therapist. You could talk about some of the challenges that you may be having supporting your client, as well as brainstorm different approaches that may meet the person's needs. So I specifically have my supervision taking place at the later half of the week. So on Fridays, I meet with my supervisor just so it gives me the entire week to really just do a temperature check on the community, on the facility that I work in. It allows me to see what are the common themes that are taking place in the groups and individual sessions. What are the interactions like with some of the clients and some of the other staff members that work in the facility? This is just my way of collecting information. I want to be able to provide as much of a full picture that I can for my supervisor. So when I'm brainstorming and talking about some of the barriers or what's working well in treatment, I got a lot of different days to go off of. Within the supervision session, I try my best to clarify what is the goal of treatment currently. So, for example, if I am working with an individual that is hearing voices, that are hearing hallucinations or delusions, I'm going to specifically tell my supervisor right now we are trying to help this person learn more about the nature of their symptoms. That is totally different than if the treatment goal is to help them identify a coping skill to manage those hallucinations. The reason why I make it clear is I want to allow my supervisor to really understand what my thought process is. And that way they can step into almost step into this imaginary room with the client and consider what are some different approaches or responses that could help us reach that goal that we specified, which is learn more about the nature of their symptoms. This should also be that time period in the supervision session where you can be transparent about where you are stuck. I think there is, this, I don't even know what to call it. Is it a stereotype? Is it a belief that, the therapist just knows it all? And I think we have to lead with confidence. However, we also need to recognize when we are struggling and maybe could have done something different or better altogether. And in that supervision session, that is a time to talk about it. This is on my mind. I don't know if I'm doing this correctly. Can you lead me to, some resources that can help me learn more about XYZ? Do I need to change my whole approach? These are all the things that you should be talking about with your supervisor so they can either support you, reassure you, or again, connect you to some resources that will help you um, just get better. One of the biggest lessons that I've learned throughout my supervision is that sometimes you need to utilize the rest of your team. So, specifically, that could be looping in the psychiatrist, looping in the nurse practitioner, bringing up some of the symptoms that you're seeing, just so that they can consider any medications that may be able to support them. I also think you just need to get a different perspective on maybe some different modalities, some different therapeutic approaches that can help you. And that is also where the supervisor comes into play. They can connect you to some of those resources and that will help you learn the basics of that modality. They can give you some pointers. Sometimes, again, if you're even recording some of the sessions with your client's consent, you can do a play by play of what are some things that were working well, and what are some areas that you need to improve. Something I really appreciated about my supervision experience thus far is whenever I'm challenged to consider, is this approach working? Are these interventions working? What is the goal? You did this intervention, why? How do you know if you made progress? If your client made progress? Should we continue to go down this path, or is it time to pivot and try a new strategy? That is something that I think sometimes we overlook as a therapist in the session because we are kind of focused on trying to meet that person where they're at, where we don't know, we may miss the bigger picture at times. And I think really being able to take a step back and view the dynamic of therapy from the a greater lens rather than specifically what happened in that specific session is important. And that has allowed me to recognize when maybe I may need to focus on building rapport and validating their experience versus jumping into trying to find coping skills to solve the issue. And that again has come from weeks of supervision over the year that over the years now, and just becoming more comfortable with recognizing and uh, just knowing what the therapeutic process looks like. It's not going to happen overnight. And sometimes we may need to slow down the process and focus on therapy and just building that rapport rather than immediately trying to utilize an intervention that we think is going to solve the problem. Before you go, please do me a favor and drop a like, share with a friend, join the community. Please do whatever you need to do to stay connected to the video. There will be a lot more coming soon. Please share with a friend that you think could benefit from hearing this. Drop a comment below. I look forward to seeing you on the next one. See ya.